event by Dr. Alok Sharma on autism and cerebral palsy and the latest development in the medical sector in this domain. Autism, as you know, autism is increasing globally as well as in UAE, and Dubai government or the UAE government has taken a lot of steps to in order to create or improve the situation of children suffering from autism. Today we welcome Dr. Alok Sharma, who is a neurosurgeon, who is a professor and a scientist. Dr. Alok Sharma has done pioneering work in this field and has treated 15,000 patients globally and has written a lot of scientific papers on the subject. He has more than 100 scientific papers on the subject. And without wasting any further time, I would invite Dr. Alok Sharma to make us aware about the latest development in this, from the medical perspective in this domain. Dr. Alok Sharma.
Good morning, everybody. Welcome you to this symposium. At the outset, I'd like to thank Puneet ji, not just for your kind introduction, but for having taken a lot of trouble and efforts to arrange this symposium, which for all of you will be a day you will never forget, because today, everything that you've been told, everything that you've believed that could or could not be done for your children will be altered forever. You're going to go back today as very, very different people. And Puneet ji, I want to thank you once again for all your efforts in making this happen, because your efforts will make a dramatic difference to the life of all the families here. I'd also like to thank Subhatan ji for having all his efforts, and Vikas ji from this Glendale International School for having helped us with the location to do this seminar. So today we are going to speak on what is new in the field of medical treatments for autism, cerebral palsy and intellectual disability. So namaste, assalamu alaikum and hello. So this is about our two countries. I'm coming to you with knowledge and information from India to all of you in the UAE. Before I begin, I always have this disclaimer that this talk is for information only. It is not a substitute for a medical consultation, for which you should consult your doctors. And you have to remember that each child is different. Each child is different, and so what is valid for one may not necessarily be valid for the other. And whatever clinical results are mentioned have been published in peer-reviewed scientific publications and medical journals. Now, this last sentence is very important. You know why? You know, anybody can talk anything today. You can Photoshop and use that to make any presentation. But when something is published in a scientific journal, it has been peer-reviewed. That means the editor, the editorial board, and 3 independent reviewers review your data, verify its authenticity, and only then that data is published. Which means the data I'm going to show you here has been reviewed by journals and only then it has been published. Dubai has always had some very special efforts in this particular decree concerning the Dubai Autism Center. They've actually highlighted the services available for autism, and as you're well aware, you have this People of Determination card which is unique. There is no other country I know of in the world that has anything like this, and this is a very, very special card. And you all aware, I won't go into the details, I'm sure you know everything that this offers, because the law sets forth your rights. It includes services, which is inclusive education at every stage, rehabilitation, inclusive job opportunities, healthcare, therapeutic and social services. So this is something unique in the country in which you live. And this is just to show you some statistics from Dubai. Although the world CDC is 1 in 36, in Dubai it is 1 out of 100. There are a lot of diagnostic services, awareness, educational support, government NGO support, and healthcare system. They are the 5 pillars of the national policy, which again are diagnostics, healthcare, human resources, education, and awareness. Which the point I'm making is the country in which we all are today has done some genuinely original and path-breaking work. And I'm going to share you how we can better this. So why are we here today? We are here today because we all have children with special needs. We've done everything we could for them. We've taken them to the best rehabilitation centers, to the best hospitals. And despite that, there are still some limitations, there are still some challenges. So I'm here to show you how science and modern medical technology is bringing new hope for these children. So what is new? What am I going to tell you that you don't already know? So we are going to look at modern brain imaging. Okay, we are going to look at how imaging is telling us what is happening in the brains of these children. We are going to try to better understand the brain mechanisms. We are going to look at how we can regenerate all of this. And then we are going to look at new treatments, which is cellular therapy and multidisciplinary management. Now, the newer treatments, we'll discuss all of these. We are going to look at cell therapy. We are going to look at oxygen-based therapies. We are going to look at comprehensive rehab. We are going to look at gut cleansing. We are going to look at micronutrient imbalance and others. Many of these things can be done in Dubai and UAE itself. Some of these treatments you may have to go outside for. So let's look at the newer brain imaging. All right. Now, this is a new brain scan that's referred to as a PET CT scan, and this is a side view of the brain. And whatever you see in blue is brain that is inactive, brain that's not working completely, brain that could potentially be partially damaged. Now, we have done original research on this, and we were the first to do it. You'll be surprised that despite such a high incidence of autism, virtually nobody in the world had looked into the brain scans of these children to figure out what the problem is. I'm sure none of you have had this scan. Which is really ridiculous, because imagine having a fracture of your leg and not getting an X-ray done. Imagine having a gallstone in your abdomen or appendicitis and not having an ultrasound done. Imagine having a heart problem and not having an ECG done or a 2D echo done. And yet for all our children, nobody has looked into their brains to figure out what the problem is. We did that, and we published that in a scientific paper. And we have, in over 4,500 children, we've done these brain scans, and every single child of autism has a damage something like this. We did this in normal children, and no normal child had this issue. So we are going to look at this in a little more detail. So these are technical terms, but we found that these parts of the brain that you can all see here, they are technical terms, so I won't go into details. Amygdala, hippocampus, parahippocampal gyrus, cerebellum, etc. So what you can see there in blue is the part of the brain that's not working. So we've actually identified clearly which parts of the brain are not working. But interestingly, we also found parts of the brain that are working more. We found that there are some parts of the brain in these children that work more, which accounts for their exceptional qualities. You all may be knowing that Elon Musk had autism. He talks about his autism as a child. So did Albert Einstein. So did some of our biggest tech geniuses who had some amount of ADHD or certain other issues. So the world looks at what they can't do. What we have done in the last 15 years is identified what is exceptional in them, what is different in them, how they can actually transform the world. These kids have some amazing abilities, but because of the brain damage, we can't see these exceptional qualities. So this is part of our research, and this has been published in a very prestigious journal called the World Journal of Nuclear Medicine, where for the first time we have shown which parts of the brain are damaged and how these progress with age. So this is our paper. Now we found something interesting. We found that the brain functioning actually decreases over the years. People thought that autism is a static problem, but what we have found is that the brain functioning actually decreases. And this is this graphic. Now if you look at the dark blue, below is the age. And you can see, that over the years, the brain functioning actually declines. Whereas in neurotypical or normal kids, it actually increases. Now, the importance of this is to show the importance of early treatment. So if you treat at an early stage, you have a lesser gap to bridge. If you treat later, you have a bigger gap to bridge. But there's something very interesting in this. Can somebody point out something very interesting in this graph? What is really special in this that nobody's looked at? That kids with autism start off higher. Did you notice that? Did you see that? The brain functioning of children with autism starts off higher and then declines. In other words, at a very young age, their brains are functioning more. Normal children start lower and progress. This is something that we noticed in our research, which is very fascinating. Which is the reason why we need to intervene early. We also done a lot of biochemical research, and we found some interesting thing. We found that virtually all our children had low levels of vitamin D, extreme levels. Test the vitamin D in your children, you will see very low levels. We found a decreased hormone called oxytocin. We found antibodies in them to something called folate receptors. We found that something called homocysteine is elevated. And most interesting, we found that the mothers have elevated B12 levels. And we believe that, and we've also explained why that causes, when mothers have elevated B12 levels, it causes antibodies in the children, and then the children can't absorb these vitamins. So there's a lot happening at the back end. So what is new about the treatment approach? So the older thought was that once the nervous system is damaged, nothing can be done about it. But the newer thought is that you can repair it through cellular replacement and repair. So this is the new thinking, that brain damage can be repaired. Now, on the left side, you see that fracture. Can you see the fracture over there? And I ask you, if you had a fractured leg, would you do physiotherapy on a broken bone? Does anybody do it? You don't, right? You go to an orthopedic surgeon, you will put some plates and screws and you do rehabilitation on that. But with the kids with special needs, we are doing exactly the opposite. On the left-hand side, the blue is the brain damage. What we are doing is we are giving rehabilitation on a brain that can't do the things we expect them to do. If the speech area is not functioning, you can give as much speech therapy as you want. The child is not going to be able to talk because the brain can't do it. That brain is inactive. But what if we could fix it? As you can see on the other side, that green, which is normal, and then did rehabilitation. Now you would get much better results. And what I'm here to tell you is that this is possible. For the first time in medical history, we can, through a very simple, a very safe, and a very effective treatment method, restore functioning to the brain, as we can see there. So, a little bit about autism. We all know that autism is a neurodevelopmental disorder, but this graphic is interesting. This graph is taken from the Center for Disease Control. This is on their website. You can actually go to the CDC website. Look at this. In 2004, 1 out of 166 kids had autism. These, by the way, are the most accurate statistics in the world. CDC publishes the most accurate statistics. 2004, 1 in 66. In 2024, it has gone up to 1 in 36. More than that, look at the increase. Every year from 166 to 150, 125, 110, 188, 68, 59, 42, and 36. And if this graph goes on the way it is, in the next year it would become 1 in 20, 1 in 15, 1 in 5, and then what? We will have a new norm then. This is not my data, this is the US CDC data. And unless we do something about this, the world is not ready. We do not have enough rehabilitation centers, we do not have enough special schools, we do not have enough infrastructure to take care of all of this. It's time government and regulators realized what is happening. We don't want to be hit by something that we can't manage. It's time we started building up infrastructure now. We need more rehabilitation centers, we need more integrative centers, we need more treatment hospitals dedicated to these children. Based on this data, there are 70 million people on the spectrum. 70 million. That is 1% of the world's population. 1%. You're not alone. You're part of the 1% of families that are affected by this. Autism, we know, is a neurodevelopmental disorder. It was, first, it was described in 1943. Boys have it 4 times more than girls, and we can classify this as mild, moderate, and severe. The main symptoms are poor social interaction, impaired communication, and restrictive behavior. Now, this is the one thing which all of you have to understand, that the treatment of autism is and will always be multidisciplinary. There's no one single bullet. All right. So we are going to need rehabilitation. We are going to work on diet. We are going to need oxygen-based therapies, and biomedical, and cell therapy that we'll talk about is part of the whole picture. Is part. We all want this one thing that we will do and our child will become okay. Unfortunately, that's not going to happen. Right? We will have to do all of it. But the good news is, when we do all of it, we will be able to resolve this issue. So I won't talk much about rehabilitation because you already are undergoing rehabilitation, and Dubai has among the best rehabilitation centers in the world. But if you notice here, above neuro-rehabilitation, I've said comprehensive rehabilitation, because what is not available everywhere is comprehensive. And what these children require, a combination of psychological therapy and ABA, occupational therapy, special education, sensory integration, speech therapy, and physiotherapy. So what happens is, you go to a center and they have part of it. They may just have occupational therapy and psychology, or somebody just has special education and something else. What these children need is everything comprehensively. So this is important. It doesn't work piecemeal. It's like diet. You need proteins and carbohydrates and fat. You need everything. You can't just have proteins. So unfortunately, in most parts of the world, depending on who runs the center, there is a focus on one thing, and what they need is all of it. The one rehab that we have found interesting need is aquatic therapy, which I know I visited several centers in Dubai that they have it, but we found that aquatic therapy has tremendous benefits that are not available with other therapies. The aquatic therapy is not swimming. Aquatic therapy is rehabilitation in water. Okay, it requires a special skill set, and we found tremendous benefits using aquatic therapy. So if there is a rehab facility where you can get this for your children, please use it. Now, the brain is like a computer, and it's got hardware and it's got software. The treatment that I'm going to talk about, the medical treatments, whether it is cell therapy, whether it is hyperbaric, only repairs the hardware. Software comes from rehabilitation, and software comes from home. People forget that the biggest rehabilitation center is the home, because the child spends a maximum time there. And so what happens at home completely alters the software that goes into the child. We find that when the whole family is working very solidly as a team, when we find that the relationship between the parents is very solid, because these children are very, very sensitive to differences between the parents. I mean, all of us, we are human beings and we have differences at home. A neurotypical kid can process these. These kids cannot. They get very deeply affected. So the environment at home, the teaching at home. Earlier it was believed that only fathers have a role, mothers have a role to play. What we are finding increasingly is that fathers have a bigger role to play. We found that our children who've done very well, it was the fathers who took the initiative. It was the fathers who spent time with their children. Autism affects boys more, right? And I ask all of you gentlemen here, when we were small, who did we look up to for behavior? Who did we want to be like? Our fathers, right? You agree? Okay, mothers are for love and affection and food and all of that. But you want to be like your dad. You're scared of your dad. You listen to your dad. Okay. Kids with special needs do that even more. But unfortunately, as fathers, we all are busy with our work. You have to make a living. You have to be out there. And we do everything for our child. We get money for our child and equipment for our child and training for our child. But we don't give the child the one thing that the child needs, and that is time. You can give your child $1 billion or 1 hour of your time. And I'm telling you as a neuroscientist that 1 hour makes more difference than $1 billion. Because these kids They listen to the fathers. And we didn't know this. We learned this from, because some of our children did brilliantly well. And in all of them, we noticed it was the father giving time. It was the father who was the captain of the team. It was the father who motivated, inspired, and was proactively engaged. So we've learned from you all, from parents, the role the father plays in the rehabilitation of children. What we actually found is what the father takes 1 hour to teach the child, it takes the mother 4 hours to do the same thing. Not because the mother is a bad teacher, but because the boys listen to the father more. Okay. Now I ask you, if you run a company and if you had to choose between two people, one of whom could do a job in 1 hour and the other took 4 hours, who would you pick? The person who does in 1 hour, right? So this is what we need to do at home. So that's why I'm telling you software is extremely important. So our stem cells will repair the hardware, but the rehab and teachings at home put in the software. Parents think, oh, we will take our child to the hospital, to the doctor, we'll give stem cells, oxygen therapy, our child will be okay. No, that will only improve the hardware. I cannot emphasize this more. It's the environment at home that changes everything, right? A couple of other things that we have to know is, it is very important that we have an unconditional acceptance of our child the way our child is. What do I mean by that? We all love our children, okay? But when our child has autism, cerebral palsy, intellectual disability, we believe that our child has a problem. Okay, let me give you an example. Some children have a hole in the heart. Have you heard of that? The heart is an important organ. So imagine if your child had a hole in the heart. Would you think your child had a problem? No. You would say you have a normal child who has a medical problem. But when a child has autism, we believe our child has a problem. That is incorrect. Our child is normal in every single way except for part of the brain, that blue which I showed you. That's the only problem. And if you fix that, you have a child who's not just like us, but better than us, because there are parts of their brain which are working better than us. We have to shift. I could say this is half full or half empty, and we both could be right. It's time we stopped looking at the half empty and looked at the half full. Believe me, this is more important than anything else. So when the family is working solidly as a team, focused on improvement in the child, when the father gives the child between 2 to 3 hours every day, okay, when there is an unconditional acceptance of a child the way the child is, the improvements that happen are dramatic and border on the magical. And I'll share you some stories about that. So let's look at this treatment that I'm going to talk about, cell therapy. So the word stem cells comes from the stem of a tree. And just like the stem of a tree gives rise to branches, leaves, flowers, and fruits, there are some cells which can give rise to all cells of the body. So a cell which can become any cell of the body is called a stem cell. So this new treatment uses healthy cells to replace damaged cells. See, up to now, in the medical world, there were only two treatments. Either you gave drugs or you did surgery. You went, cut, sutured, removed stuff. Now we have a new treatment. That's not just a drug, not just a surgery, but it repairs at a cellular level. Imagine if you have a cut. All of you had a cut in the hand sometime. What happens to that wound? It heals itself, right? In 2-3 days. That is called biological healing. That the local stem cells, they do that healing. So we are talking about biological healing. We are letting the body heal itself. So this is the difference. So if this is what on the left-hand side you see blue, which is the damage, if you gave stem cells, the damage would go away. I just, in a lighter vein, try to explain to you, when I became a neurosurgeon in 1992, if I needed to take a video film, I needed that camera. For still films, I needed this other camera. We had computers to work with. To listen to music, I had to have that player. For a calculator, the telephones were those types, and calculator and television and torch and compass. Now all of this, if at that time somebody told me that all of this one day would be in the palm of your hand, it would be unbelievable, right? You agree with me? 30 years ago, if somebody told you that all of this would be in your hand, in your pocket rather. But it's happened. Exactly the same thing is happening with stem cells. There are multiple things for which you needed other drugs to modify the immune system, to help with neurogenesis, to prevent cell death, to give growth factors, angina, all of these. If 30 years ago somebody told me one thing would do it, it was science fiction, but it's happening. And stem cells are the cells that do that. Now, worldwide, stem cells are used in multiple. You can see that there are 290 papers in neurological disorders. It's used in orthopedics, wound healing, cardiac, pulmonary, COVID, diabetes, etc. In neurological conditions in autism worldwide, there are over 30 studies. Cerebral palsy, there are over 40 studies, and there are other conditions like spinal cord injury, head injury, brain stroke, muscular dystrophy, etc. In the medical field, if any of you are doctors here, we have one Bible, Quran, or Gita. It's called Harrison's Principles of Internal Medicine. This is the go-to book. And this has introduced a chapter on regenerative medicine, stem cells, and this is what it talks about, the role of stem cells in neurological disorders. The highest recognition in medicine is the Nobel Prize. And 3 times in a 15-year period, 1990, 2007, and 2012, the Nobel Prize has got to stem cell research. There is no field of medicine which has got the Nobel Prize 3 times. Stem cells is the only one. And what we do, stem cells from the bone marrow, got the Nobel Prize in 1990, a long time ago. So how do these stem cells work? The first thing is they have the ability to multiply. So a single stem cell can become into thousands and hundreds of thousands of cells. The second, the ability to convert into any type of cell. This is the most important property. So the same stem cell can become a heart, it can become a liver, it can become a kidney, depending on where you put it. So that's the beauty. Something which can multiply and something which can become whatever you want. So then it also improves the blood supply and it releases certain positive chemicals in the body that help in the healing process. So they repair, regenerate, and replace damaged tissue. That's what these cells do. Broadly speaking, there are 2 types of cells. You can take it from your own body or from the child's body, and or you can take it from somebody else that is a donor. So broadly speaking, there are 2 types. We use autologous. Now, there are other classifications. You can get stem cells from the embryo. What is the embryo? So life starts when a father's sperm and mother's egg comes together. It becomes a fertilized egg. And on the 5th day of life, we are a grape-like bundle. On the 5th day, all of us in our mother's wombs, what a bundle of stem cells. All of us. We started life as a bundle of stem cells. And from those stem cells, the entire body was formed, which means that those cells have the ability to become anything. Now, in 1998, they discovered these embryonic stem cells, and the whole problem with stem cells is that this is a very controversial area, so we don't use it because there are a lot of ethical issues about the use of embryos. We just want to tell you that we do not use embryonic stem cells. And whatever negative you hear about stem cells is because of embryonic stem cells. People confuse and think that all stem cells are from the embryo. No. The second set of stem cells is from the umbilical cord. So when the baby is born, there is an umbilical cord which connects the child and mother, and this is very rich in stem cells. In Dubai now, I think they are saving. Have any of you saved your umbilical cord cells? Yeah. So if you've saved your cord cells, then that can be used, unfortunately not for autism, but it can be used for various blood disorders. What we use is adult stem cells from the bone. So inside our bone, there is a liquid called bone marrow, where the body's blood is produced, and this is rich with stem cells, and we are using this from the bone marrow. And the last is induced pluripotent stem cells, which is a combination of adult stems outside and embryonic inside, but we are not using this as of just now. So this is still in the research phase. So whatever I talk about will be cells from our own bone. I repeat, we do not use embryonic stem cells and we do not use umbilical cord stem cells. So we work with adult stem cells because one, they're very, very safe. They don't form tumors, they don't get rejected, and you can easily get it from a single needle. And there are no ethical issues because you're using your own cells to heal yourself. There is nothing from the outside, so there can't be any ethical objections to it. Now, how do we put them back? So we prefer to put it back by injecting it into the lower back, into a spinal fluid that takes it to the brain. But you could also give it intravenously, intramuscularly. We use it for a condition called muscular dystrophy. You could give it in the arteries. You can give it through the nose. In Dubai, they were using stem cells through the nose for COVID. You can put it directly in the brain as well. But we prefer what you're seeing on the left side. So how do we do it? There are 3 steps. The first, as you can see on the left side, we put a needle into the pelvic bone. So the pelvic bone is here. We put a needle into this bone. That is a real picture of that. And in 15 minutes, we take out the liquid inside this bone. The liquid that we take out is taken to the laboratory. We filter it, take out the stem cells, and then with a very thin needle, we inject it into the lower back. So in this whole treatment, there are just 2 needle pricks. With one needle, we take out bone marrow, and with one needle, we put it back. There is no surgery. There is no cutting. There is no stitching. There is no intensive care. There are no big lines and tubes and everything that we associate with surgery. Just 2 needle pricks. What's a needle prick? When you collect blood for your blood test. We all have had blood tested. That's a needle prick. That's all you get. Except one goes into the bone and one into the spinal fluid. So it is as safe and as non-invasive as you can get. Now let's see a small video of how this is done. So here you can see the bone marrow being aspirated. There you can see that we take it to the laboratory. There, check the stem cells. And then with a very thin needle, now we are injecting it back. So I'd like to play it again because this is important to show you the simplicity. There you can see the child sleeping. We are aspirating the bone marrow. Take it to a laboratory. Separate the stem cells. And with a very thin needle, we put it back. That's all. You can see how thin that needle is. That needle is thinner than the needle with which you collect blood. So it's a very thin needle. And what are we injecting inside? Our own child cells, your own cells. Nothing from the outside, nothing artificial, no chemicals, no agents, no preservative. Fresh cells. Take it out, separate it, and put back instantly. A laboratory to separate is in the operation theater. Cells don't even, the bone marrow doesn't go outside. There's a window between the OT and the lab. Bone marrow goes in, stem cells come back and get injected. So are we the only people doing it? No. There's a lot of research worldwide and I'd like to share some of that. So there are a total of 33 scientific studies which deal with 461 patients, of which 359 have improved. So worldwide, from the published, this is not the number of patients treated. This is the number of patients which have been published. Please remember that publication takes a long time. So if I treat a patient today, I have to follow up that patient for 1 year to see the results and then collect that data for another year, and it takes a year to publish. So the work I'm doing today gets published 3 to 4 years from now. That is why the number of publications is still lesser. The work done is much more. But this is published. So the world's first paper came from India. We wrote that paper. The second paper was from China, the third from Italy, the fourth and fifth were from the United States, the sixth was again our paper from India, the seventh from Vietnam, the eighth from Iran, and the ninth one from the United States. So you can see that this is something where Asian countries, India, China, we have leadership in this over the Western countries. So this is the world's first paper. This was written by us. It's 2019, and it was using bone marrow cells for autism, an open label proof of concept study. This is that paper. So we showed in our paper 91% success rate, which is pretty good because it's a very, very high success rate. Then this is the second paper which came from China, and they showed a 88% success rate, which is again good. The next paper came from the United States by Dawson et al., and they showed a 90% success rate. And this another paper came from the United States by Kimberly et al., and they showed 90%. So you'll see more or less the results are more or less similar. This paper came from Mexico, and this was 95% success rate. This paper from Vietnam, and I'm not going into the details because they are technical, again a 93% success rate. This paper from Italy, this showed a little lesser, 78% success rate. And this, now this is not what I showed you earlier, were individual results of people. That means the doctors had done the treatment and they published. This is not individual work. This is what is called a systemic review and meta-analysis, where they take different studies and put it together. So they looked at 461 papers, 461 patients, and they concluded that it is safe, it improves patients with autism regardless of which type of cells we use, and there was significant improvement. So this is called a meta-analysis, an analysis of an analysis, and that showed this. In this other paper from China again, and they looked at 325 patients, and again they said it is safe and effective. So not just individuals, but meta-analysis have also shown two things: safety and efficacy. Now this is our published work. So our next major paper, the first one was in 2013, the next one was in 2020. This was published in the American Journal of Stem Cells. And this was a larger database. That is the published paper on the left. This was 254 patients, and we showed here. Now, if you look below, you will see the difference. So there's social interaction improved in 67%, eye contact 80%, attention concentration 80%, stereotypical behavior 53%, aggressive 56%, hyperactivity improved 67%, self-injurious behavior 58%, sitting tolerance 86%. Command following 84, like that. So speech in 61 and communication in 60. So this is our data from the patient that we have treated. So like you can see, all children don't improve in everything, but this is just the statistics. And these are objective scales. So there's something called the Indian scale for autism, and in that 94% improvement was there. And the CAR scale, which is more universally accepted, again, there was a 95%. But there's something interesting we noticed. We noticed that kids below 5 on the left side, they had the highest success rate, 98%. And then between 5 to 10, it dropped to 90. And then below that, it dropped to 90 and 91. So the earlier you treat, the better results you get. We found that children below 5, we have a 98% success rate as compared to 90 and 91 in children who are older. Again, this matches up with the earlier thing that the brain damage keeps on increasing. So the longer you wait, the less will be the results. Now, apart from the clinical improvement, we also studied improvements on the scans. So above you can see here, on the above screen, the blue is the damage part. And now this is done on a Siemens machine. There are two companies that make the scan, Siemens and GE. I mentioned the companies to let you know the reliability. These are world standard companies. And below, you can see after 6 months, you can see all the blue is gone. It's the same child. The blue is the damage above. You are seeing different sections. And below you can see in 6 months, a significant amount of damage has been resolved. We were the first in the world to show that the brain damage in children with autism can be reversed. Nobody had even done the scans to see the damage. We have not only shown the damage, we have shown that this damage can be reversed. Now this is scanning on a GE machine, General Electric. So the picture, that's why the pictures are slightly different. And again, above you can see the blue is the brain damage. And you can see below, after the treatment, the brain damage is getting repaired. So that is the good news to all of you families, that the brain damage in our kids can be repaired. And we've shown that this in not 1, 2, or 100, although our papers are of smaller volume. Our next paper is almost 1,000 patients, but we've clinically treated over 4,000 patients. We've shown this in 4,000 kids, not 1 or 2. We've published 16 scientific publications in autism. After our first one, we've published 16 more, so we have a large volume of data. Also in medical textbooks. So now, as doctors, doctors study and read from medical textbooks. So these textbooks, there's this textbook on recent advances in autism by the SMG group. And they not only introduced a chapter, stem cell therapy in autism, but they asked us to write it. So when when editors world over are looking for who will write a chapter, they come to us. So we wrote this chapter in this book. So earlier what I showed you was papers. This is a medical book. So let's look at a couple of videos. I'm going to show you two videos. One is a child from America. The reason why I'm showing you that video is the child's father was a cardiologist and the mother is a nurse. So two medical people. This child was very, very severe, was going to a special school, not going to a normal school. And after a treatment, he's improved so much. He's off the autism spectrum, not just going to a normal school, but topping in the normal school, getting A+ grades. This child is now completely independent. I spoke to the father some time ago. He now travels. They live in America, but he recently traveled Europe all by himself. Okay, so that, and he's graduated and he's doing wonderfully well. The second video I'm going to show you is of, all of you know how difficult it is to manage one child. Here's a family who had triplets, all three of them had autism, right? And they had severe autism, and we will see through a video how their life got altered after our treatment.
I couldn't get him to engage with me. I couldn't get him to give me eye contact. Over time, he started to lose a lot of vocabulary. Right around 18 months to the age of 2 years, he just slid backwards.
He would flap like that, and he would walk on his tiptoes, look at the wall and be talking to the wall. He had problems with eye contact. He'd never look you straight in the eye. He had problems with his speech. Some research and found out about NeuroGen. And the big question that I had in my own mind was, what is there to lose? And I could not come up with a good answer, and I said, we have to do it.
We started seeing better eye contact, definitely a difference in his engagement with us, with his sibling, his mood. He was so much calmer. Now he's all about taking his own shower. I have to just prompt him to get out, but he'll wash himself and he'll put his clothes on. Saw the PET scan images. I can't tell you the word, we were just so excited and thrilled. The areas that were hypoactive or non-active were warm. There was activity there. Ganesh has gone from the third grade, fourth month reading level
to a seventh grade
first month reading level in 5 months.
And look at his scores now, A+ grades everywhere. A GPA of 3.8 out of 4. So this is what is possible with a treatment. Now this is
different doctors, we went to different hospitals, and when I brought it up, they were like, oh, no, don't worry, it's because they are boys, they are triplets, they were premature. I would be walking out and I'm like, bye, and no child is crying, no child is waving back bye, and by then for sure I knew that they should be doing that. The children had this behavior of disappearing. In fact, Eric disappeared 3 times in the middle of the night. The biting, the spitting, the scratching. How are we going to stop this behavior? We went to see the neurologist, and in 5 minutes he said, these children are autistic.
As parents, it was very traumatizing. First of all, we didn't understand what autistic means.
So I decided to really get to read a lot about autism. I remember the first time I read about stem cell. I was like, wow, this is really good.
We had a lot of questions which we asked, and we got very clear answers from Dr. Sharma.
The day of the stem cell itself came, actually I was a bit anxious, of course, but really I didn't have fear. A bit of apprehension, anxiety, of course, as a mother, but I knew they're in good hands.
We put a needle in this pelvic bone, and then we take out the bone marrow, which is the fluid inside the bone. the pure stem cells, once they are ready, a thin needle is inserted into the lower back. We inject the stem cells into the cerebrospinal fluid. It flows all the way up to the brain.
Things that would have taken probably years to be accomplished in my sons, in like 8 months' time, we've really been able to come very far. Just with water.
They used to defecate on their clothes, but now they can use the toilet. We've seen a lot of improvement in terms of spitting. The tantrums have reduced. Sleeping used to be a problem before, but at the moment, he is taken to his bed, it takes a few minutes and he is asleep.
You see my son's cycle. You try to make them understand what it is to pedal, and they couldn't. But after stem cell, when we arrived in Kenya the following day and we went out, and these guys could cycle. I'm going to send you to buy tomato paste, okay? I'm going to send you to buy what?
Tomato paste.
In the shop. Where is the shop?
It's here.
Okay. So I'm going to give you
Money.
for what?
To buy tomato lollipop. I'm going to wear my shoes. That's right.
Parents ask me, so do you really think stem cell works? And I'm like, I can see changes, I can touch, I can feel, I can smell. Of course, for me, stem cell works. I'll do it until my children get well.
So that's just a couple of stories to show you what benefits can happen. Now, very briefly, we'll look at cerebral palsy. Now, in cerebral palsy, there is damage to the brain, but the problem is more in the body. There is stiffness, there is tightness. In autism, the problem is in the mind, in speech, in behavior. There are different types of cerebral palsy. Either one side of the body can be affected, or just the limbs, or the entire body. And the damage, as you can see, remember the scans in autism, you saw lighter blue. The damage was a little less. In cerebral palsy, the damage is far more severe. And there are different medications that can be used to help with the spasticity, convulsions, tightness, etc. There are different surgical procedures that can be used, orthopedic and neuro. But none of this repairs the damage in the brain. With our cellular therapy, as you can see on the left-hand side, you can see the blue that is damaged. And on the right-hand side, you see that the damage has been resolved. So this is the improvement with cell therapy. The cells get to the brain and repair the brain damage. And it's important for you to remember these pictures, because what you need to know is that the damage in the brains of your children also can be similarly reversed. So this is our paper on, clinical paper on bone marrow mononuclear cells for cerebral palsy. This wasn't the world's, in autism we wrote the world's first paper. In CP it is not the world's first paper. We published this in 2015. We've written a total of 15 other scientific papers on this. So all our work is published in international scientific journals, which means it has been peer reviewed, it has been verified, and its authenticity has been established before it is published. Again, there's this international textbook, European textbook from called InTech, Cerebral Palsy Challenges for the Future. Again, they introduced a chapter, Stem Cell Therapy for Cerebral Palsy, and they asked us to write this chapter. So books written for medical doctors are not only introducing a chapter on stem cells, but are asking us to write it. Now, the next is a small video. Again, this is a child from Nairobi. This child was completely wheelchair bound, could not use his hands, could not use his legs. And let's see what improvements cell therapy did with him. You can see the child before, spastic quadriplegia, all the hands and legs affected. And from a complete wheelchair-bound state, you can see now he's able to stand up, he's able to use his hands to wear and remove his clothes, he's able to pack a bag. All this was impossible before, actually able to charge a mobile. And something simple like opening a fridge, taking out a bottle of water and opening it. For the mother, this was so important. My child can actually take out a bottle of water and drink by himself. And now you can see there, the child is actually now, with a little support, he's walking on his own. The last thing I'm going to talk about is intellectual disability. Earlier, this was referred to as mental retardation. Now we don't use that word at all, and that word is replaced by intellectual disability. And here again, the world's first scientific paper, an open-label proof of concept study has been written by us. Now, this is a paper which has a comparison. So we had two groups. We had an intervention group, that means 29 patients who took cell therapy and rehabilitation. And there was another group that took only rehabilitation, who didn't take cell therapy. And then we compared the data between the two of them. Now look at the data. Now in the intervention group, as far as cognition goes, those who took cell therapy and rehab, 55%. Only rehab, 17%. Big difference. Same thing in memory, 88% with cell therapy and rehab, 12% in only rehab. So only rehab helps. As you can see, all of you have taken only rehab. Only rehab helps because the orange that you see everywhere is only rehab. But when you combine it with cell therapy, which repairs the brain, and take rehab, you can see across the board, whether it is problem solving, understanding of relationships, social inhibition, toilet training, command following, eye contact, aggressiveness, attention, in all, the results, cell therapy combined with rehab are better than rehab alone. And these are some outcome measures again showing that the results of, these are the scores, FIM and IQ. When you combine cell therapy, it's higher than just rehab. And we've published 5 scientific papers in international journals on this. Now, one important thing, because I'm sure as parents, the first thing in your mind is, how safe is this treatment? Are there any complications? Can something go wrong? All right. So what we have found, the good news is that there are no major adverse events or complications. I mean, no child of ours has deteriorated, become bad or worsened after the treatment. No neurological deterioration. However, there are some minor means reversible, and one of them is epilepsy. So in 3% of our children, there is an increase in epilepsy after the treatment. Now this is a significant side effect because the majority of kids, these are kids who've had epilepsy in the past or whose EEG is abnormal. Now 10% of our kids, now this is the epilepsy part is something to take cognizance of, because when it does happen, it means if you do 100 children, 3 will develop epilepsy after the treatment. Now this epilepsy is controlled with medications, but it is an adverse event and it is something that we note. 10% of our children get a headache after the treatment, which lasts for 2 or 3 days. But this happens immediately after the treatment and it resolves by itself within 48 hours. It is not dangerous, it's reversible. And some children have nausea, vomiting, local pain, etc. So one must be aware. See, there is no treatment in the world which does not have adverse events. It's just that we talk about it, not just talk about it. We've actually published a paper on it. We published a paper, Seizures as an Adverse Event of Cellular Therapy in Pediatric Neurological Disorders. People usually publish only their good results. We publish our adverse events as well. Because if you know the adverse events, you can take an informed decision. Right? So this is very important. Now, ethical aspects of our work. So all our work is done with permission and with oversight of our health ministry, the CDSO. So we have the equivalent of our FDA is the CDSO. So there is an institutional ethics committee which is registered with the ministry. So we have an oversight. We can't just do anything that we want. Our institutional ethics committee decides what we can do, cannot do, and all our protocols are reviewed by this committee. Now, what should be noted is that cell therapy is not a cure. I must say it's not a cure for CP. It has to be combined with conventional and comprehensive rehab and medical treatments to help reduce symptoms. So you have to combine it. Parents sometimes feel, oh, I'll do cell therapy, my child will become completely okay. No, it's going to work together. And again, it is not a standard of care. but it may be considered as a clinical option. What is the difference? A standard of care is something which has to be given. A clinical option is something which a parent decides you want and a doctor decides they can offer. So it's very important that we are aware of this. Now we will look at some other therapies that are referred to as integrative therapies. So we will look at hyperbaric oxygen, ozone, gut cleansing, diet, acupressure, supplements and vitamins. So some of them are oxygen based. So this is something called a hyperbaric oxygen chamber. This is a chamber at which oxygen is given at a higher pressure. So this is the chamber in a hospital. You can see the parent and the child lie comfortably inside. There's a television screen with cartoons and stuff. So that the children really enjoy this. They think they are in a space capsule or something. Each session lasts for about an hour. How does this work? See, normally, all of us right now, we are breathing oxygen at 1 atmospheric pressure. All of us. At 1 atmospheric pressure, the oxygen represented by those blue dots, it is carried only by the red blood cells of our body. So our blood has got red cells, white cells, something called platelets, and there is a liquid called plasma. But when you give oxygen at higher pressure, the oxygen goes into the liquid. So right now, only our RBC, our red blood cells, can carry the oxygen. When you give it under pressure, the entire blood is carrying the oxygen. So oxygen goes to parts of the brain and body that it can't go with only red cells. And what we found is that it improves the immunity, oxygenation, metabolism, energy levels, reduces fatigue and overall functioning. So hyperbaric oxygen has a lot of benefits. Then ozone therapy. Now what is ozone therapy? So oxygen is O2, ozone is O3. So it's a form of activated oxygen. There's one molecule more. And how it works is that it kills all the infections, whether it's virus, fungal, bacterial, etc. Because our children on the spectrum are more predisposed, particularly to fungal infections. It reduces inflammation and swelling, reduces blood clots, and is an antioxidant. So we are finding the use of ozone to be very beneficial. And this is how it is given. This is a chamber in which the child sits and the ozone is given. You can also give it from the ear. It can be breathed. We can give it through the rectum. There are different ways of giving this. So this is how it helps. It helps in the gut health and oxygenation of the whole body. Then micronutrient supplementation. We've found that many of these supplements, these micronutrients or vitamins are less. So when you come to us, we actually evaluate. Now we don't believe in a one size fits all. So we actually evaluate which is less, because very often in some of our kids, some levels are higher. Elsewhere what they do is everybody is given a whole bucket. No. We identify what is less. So in particular, we found vitamin D to be less. So we supplement only what is required. So we are also finding that a significant number of our patients have a genetic defect, what is called MTHFR mutation, where their body can't convert something called folic acid into folate. So then we have around, you can see we have different treatments for that. Then gut cleansing. We believe that the gut has a very important role to play in autism and that it needs to be cleansed. So how do we clean the gut? First, we do something called a gut microbiome test. This is not a regular stool test. It's an extensive test. The report is in 20-25 pages, which identifies which infection are there in the gut. Is it bacterial? Is it fungal? Is it viral? What is the nature of the infection? It identifies what are the chemicals inside the gut that are affected. It identifies what are the hormone problems that are inside the gut. So we do a very detailed gut microbiome testing and we identify the infections and the deficiencies, and then we give specific treatments. The difference between what we do and what everybody else does is we identify the problem and just target that and correct that. Then we use prebiotics and postbiotics, and then we do gut cleansing using rectal ozone. So we believe that the cleansing of the gut has a very important role to play in our treatment. Now in older children, those who are 20 plus, we can also use something called colon hydrotherapy, but we don't use this in children. We use deep tissue mobilization. We believe it helps as well. We focus a lot on diet, and there are foods to eat and foods not to eat. This you're all aware. That probiotics, prebiotics, ketogenic, gluten-free, casein-free, vitamin-rich, and camel milk. There is a lot of interest in camel milk today. Unfortunately, in most parts of the world, you don't get camel milk, but if you can get fresh camel milk, please use it. There is a lot of data to show, but it has got to be fresh camel milk. You can't use processed camel milk, right? There are different parts of the world where there are several hundreds of papers that are actually showing the beneficial effects of camel milk in children with autism. So please, if you can get it, I would suggest you use it. What to avoid is sugars, additives, pesticides, anything that's genetically modified, inorganic processed foods, and hard to digest starches. We believe in a ketogenic diet, which is high in fat, enough protein, and low carbohydrates. Now, what is the scientific basis of my work? Okay. I'm talking over here. Is there a base? I mean, am I just talking, or is all my data being reviewed? So we have over 100 papers, 106 scientific papers in various national and international journals. This is very important. Wherever you go for the treatment, you may take the treatment in any part of the world. But the first thing that you must do is you must ask your doctors, is their work published in peer-reviewed journals? Because if it is published, it means that data has been verified, authenticated. The scientific content, the clinical results, the ethical content. Why? Because journals do it not for you, not for us. They do it for themselves. If any wrong data gets published in the journal name suffers. To protect themselves, they verify the data. So when work is published in a journal, you can be rest assured that the data being presented has been peer-reviewed. So we have, like I showed you, we've got 15 papers on autism, CP, intellectual disability, muscular dystrophy, etc. So all the data I've presented is from published peer-reviewed journals. Nothing I've said which is unpublished. Like I said, and we have chapters in these books. There's this book on physical disabilities. This has a chapter on stem cell therapy in pediatric neurological disabilities, etc. We've also published 18 books of ours. So initially, I wrote several books for doctors. So this stem cell therapy for neurological doctor, the top books are all written for doctors. And to my surprise, I found doctors were not reading. Who was reading these books, Parents. Okay. Doctors didn't seem so interested. So then we started writing books for parents. There's a parent guide for autism, parent guide for cerebral palsy, muscular dystrophy. All our books are distributed without cost. You can download digital copies from our website. We give free copies. Anybody who asks, we courier to them. We do not charge for our books. So all our books are given without any cost. Now we've treated, the older slide, 14,000. We are now close to 15,000 people from 163 countries, from all the 6 continents. So my conclusions are that, first, newer brain imaging is giving us information about which parts of the brain are affected. Believe me, just seeing on the image, now it's not a happy thing to see that your child's brain is damaged, but when you see it, for the first time you realize why your child is the way your child is. Why can't your child talk? Why does your child have behavioral issues? Why can't your child have a normal education? And just seeing it clears up the mind. So we believe information is power. Once you have information about your child, you can help them. Then again, multidisciplinary rehab and medical treatments help. So it is not that everybody has to do cell therapy. You must do the regular rehabilitation, which is already going on. You must take all the medical treatments that your doctors are doing. If your children improve with that, there is no need of doing anything new. But if despite all the treatment, our child still has some limitations, still has some problems, still has some issues, then one can consider cell therapy. And adult cell therapy is safe. Our data showed that it is a safe treatment except for that 3% risk of epilepsy, which is reversible with treatment for autism and cerebral palsy. And now I'd like to share the views of, just a couple of other things. What we have found is that the best results are achieved when there is an absolute acceptance of the child the way the child is. So we have to accept our children the way they are. You must have a complete understanding of what is happening to the child. The whole family needs to work as a team. We found that when the family works as a team, miracles happen. Then one of the other things we've seen is that if you structure your day properly, if the day is scheduled, fixed time for breakfast, fixed time for lunch, fixed time for dinner, fixed time for everything, these children respond much better. Cell therapy is one part of all of this. Comprehensive rehabilitation is very important. Correcting of micronutrient imbalances is also very important. All this can be done here itself. Rehab can be done because I believe Dubai is among the best rehab centers in the world. Micronutrient imbalances also, and the various integrative therapies, which are also, I believe, hyperbaric oxygen is available in Dubai. Ozone is available in Dubai. Please find places over here. And please treat your children with all these things. Let's not sit back and do nothing. A lot of what I've told you is available right here. Okay. in the Emirates. So please find places where you can do hyperbaric oxygen, ozone therapy, rehab. You will see improvements in the child. Work on the micronutrients, simple blood tests, correct them. Work on the diet. This all can be done right here. And if despite that there are no improvements, cell therapy at our facility or anywhere in the world, the different parts of the world where it is being done, is a clinical option. We are opening up a center in the Bahamas soon, mid-2025. This will be ready. Now, I just like to share, this is the last part, the views of the world's two biggest democracies are India and America. And I'd like to share the views of the Prime Minister of India and the former President of the United States on cell therapy. So I'm very fortunate that in a book that I have written, this is a book written by me, the Honorable Prime Minister of our country, Shri Narendra Modi ji, has written an introduction. That's his signature. It's a real honor when somebody at the level of Narendra Modi ji writes an introduction for your book where I talk about my treatment of cell therapy for a condition called muscular dystrophy. That is myself presenting that book to the Honorable Prime Minister. He is a great proponent of cell therapy. He believes in it a lot. And let's hear him speak about.
जापान गया तो जापान मेरे कार्यक्रम में मैंने एक कार्यक्रम क्या जोड़ा, मैं वहां एक नोबेल लॉरिएट साइंटिस्ट याकामाहा को मिलने गया। मैं इसलिए किया गया कि उन्होंने स्टेम सेल के अंदर जो रिसर्च की है, मैंने जितना पढ़ा था तो मेरे मन में आया था शायद इनकी एक खोज हमारे काम आ सकती है क्या है। हम गए तो वहां गए, उनसे चर्चा की और बेंगलोर के हमारे साइंस इंस्टीट्यूट के साथ आज उस दिशा में हमारा काम हो रहा है कि स्टेम सेल्स के द्वारा हमारे युवा साइंटिस्ट कुछ खोज करें।
So that is the Prime Minister of India talking in the Indian Parliament about stem cells. You know, leaders at that level don't talk about medical topics. So when the Prime Minister of the country talks about a treatment in Parliament, it means something. Prime Ministers and Presidents don't talk about things that are unimportant. They talk about things that have a social impact, that have a value. And now we'll see what President Obama had to say about stem cells.
With the executive order I am about to sign, we will bring the change that so many scientists and researchers, doctors and innovators, patients and loved ones have hoped for and fought for these past 8 years. We will lift the ban on federal funding for promising embryonic stem cell research. Scientists believe these tiny cells may have the potential to help us understand and possibly cure some of our most devastating diseases and conditions, to regenerate the severed spinal cord and lift someone from a wheelchair, to spur insulin production and spare a child from a lifetime of needles, to treat Parkinson's, cancer, heart disease, and others that affect millions of Americans and the people who love them. There's no finish line in the work of science. The race is always with us. The urgent work of giving substance to hope and answering those many bedside prayers, of seeking a day when words like terminal and incurable are potentially retired from our vocabulary. Today,
So with that, I'd like to thank you, Shukran. Thank you for listening to us. I'm open to any questions that you have on this subject. So the purpose of this talk was the following, like I said. First, to give you awareness that a lot is happening worldwide. I shared with you data, not just my data. I shared with you data from the United States. I shared with you data from Vietnam, Iran, Italy, all over the place. So you saw that there is work happening all over the world. Second, to let you know that you should be doing your own internal studies, your own research, and find out simple ways to help our children. For example, just supplementing, just do one thing. All of you test your child's vitamin D, and I almost guarantee you it will be less. And much less, not little less. Because we found in our data almost all children who come to us. Now, vitamin D can be easily supplemented. And vitamin D, you know what it takes to make vitamin D? Just exposure to the sun. You know, if you're just exposed to the sun, when you're exposed to the sun, the skin makes vitamin D. But despite the fact that we are in the Middle East where there's a lot of sun, our children are not exposed to the sun because they're always indoors. So there are simple things which you can do, supplement their vitamin levels. Very simple stuff at home. Look for rehabilitation centers in Dubai itself that are comprehensive, that do all the therapies. Please find hyperbaric and ozone therapies. Let us start with that at least, okay? Now, if your child is improving, fine. If not, you have an option. I shared with you centers all over the world that are doing this work. And then you could consider doing cellular therapy if your children are not improving. As I showed you from our data, it is simple. They're just 2 needle pricks. There is no surgery. There's no cutting. It's very, very safe. There are some complications which I listed. And they are effective. Of course, they are more effective in children who are younger. Children below 5 have a very good success rate. Children older don't. So I'm here to give you hope. I'm here to, let you know that what was believed 10, 15 years ago, that nothing can be done for these kids, is no longer valid. There's a lot of science, development, and technology happening. We have hope for our children, and our children have the potential, not just to lead independent lives, but to be able to specialize in something. That's what we found. All these kids have some special trait. We have some kids who are fantastic with chemicals, some who are good with mechanical things, some who are good with painting, some who are good at some sport, some who are good at mathematical ability. So all these kids have something unique or different. And if we identify that and make that a vocation, we're able to give our children that opportunity, that hope, that possibility, that potential to lead independent, as close to normal lives as is possible. So once again, I thank you for your attention.
My grandson is here. So he was severely autistic, and with the shots, he has improved a lot. So I wanted to say thanks. I thought just to witness that there is improvement with the stem cell therapy. So, but we will be coming again for next shot. So he's 11-year-old child, so the improvement is less. But definitely the eye contact and the affection to the siblings and all areas, he has improved.
Thank you so much. Thank you for sharing that. Thank you.
Thank you.
Our daughter Hannah to NeuroGen last year, if you remember. We had some pictures with you in the office, and it has been a great experience. And just also to add to, I think there was someone who was asking about the stem cells in Panama. We have tried both. We did stem cells in Panama 2 years ago, and we did the stem cells in NeuroGen in 2023. In terms of and of course, again, every child is different. In terms of the side effects that we have seen, when we did it in Panama, we had about increased hyperactivity, almost, I would say, for a couple of weeks, and then things came back to normal. We have seen slight improvement, of course. And then I would say a year after that, we went to NeuroGen and we did the stem cells as well with Dr. Sharma. In terms of the side effects, there was no increased hyperactivity. There was some sort of a muscle spasm for about a week after the needle. And in terms of improvements, we have seen, to be honest, significant improvements in terms of hyperactivity, tolerance, patience, and things like that. She's being more patient now. And we are planning to go back for a second dose